name is Kendall and I'll be your student nurse today. I'm going to pull this curtain for your privacy. Can you go ahead and state your name and date of birth for me?
John Dale XXXXXXXX.
Alright, I'm going to go ahead and raise your bed up a little bit just so it's comfortable for me. Alright. This. I'm going to go ahead and assess your abdomen.
Okay.
Do you have any allergies?
I do not.
Okay. I'm going to inspect it first and then I will listen.
Sounds are normal, active. Not positive. Okay, so we're gonna go ahead and palpate. So let me know if you have any tenderness.
Okay. Listening for a minute in each quadrant, making sure I hear sounds in all 4 quadrants. And I'm going to palpate. Do you have any tenderness or pain?
I do not.
Okay. Perfect. So I have an order to do a tube feeding. So I'm going to place a tube down your nose, in your stomach. And then I'm going to hang the floor feeding back. Does that sound good?
I didn't either. Why are we so dumb?
Okay.
I heard this and I was like, man.
So I'm going to place this pad on you.
Why are you so good?
Put on my gloves.
I looked and I go, I have to redo that. Oh my god. What happened? Shame on all of us. I will cry. It's okay.
Alright, I'm gonna come over here and open my tube.
Now that I'm like not confident. Yeah. Hello.
Throw that away.
Hi, I'm Ashley. I'm your student nurse today.
I'm going to measure from the patient's nose to his ear, and then from this ear down to the xiphoid process. And I'm going to mark that with a piece of tape.
I'm going to perform some hand hygiene. Okay. And close your curtain to ensure
And then this will be how far I insert the tube.
Okay, so we're going to start with an abdominal assessment.
I'm going to lubricate the tube so it goes in a little bit easier. 2 to 4 inches. Alright. And then I will have the patient sit at a 45-degree angle with their head up to begin. And I'll have them check to see which nostril is easiest for them to breathe out of. And then I will make sure that there is no obstruction in that nostril, and that will be the nostril I place the tube in. Making sure it stays along the bottom of the nasal passage. Now when the patient begins to gag, that typically means you hit the pharynx, and you're going to have them tilt their head back and continue advancing the tube until you reach your piece of tape. And then put that up here. I'm going to secure it loosely to my patient's nose so I can check placement. Take my syringe, aspirate gastric contents, checking for color and consistency. I will remove that and come over here and check pH, making sure it's about a 7, which is normal for the stomach. I will push the gastric contents back in, and then I will come over here and get some sterile water, maybe, to make sure, and then flush it to make sure that there's nothing stuck in the tube that would prevent the food from going down. It went in well. I'm going to disconnect this. I'm going to place this, pin it to the patient's gown, and leave it like that while I prepare my food bag.
And this is not a sterile procedure.
I would cleanse the top of my food solution that I got from my order. I would make sure that's not expired, and then I would pour it in here, and then I would make sure it's clamped before I fold it in there, which it was. And then I would take this cap off. Wait. And then I would prime it so that all of that air doesn't get into my patient's stomach. When the food gets down there, I'm going to reclamp it. And then I'm going to walk over here. Cap my bag of food and hang it. And I would write the date, the time, and the amount on the bag. And then I would come over here and I would attach it to the tube. And before I did that, I would remove this tape and put a more permanent piece of tape on there just to make sure it doesn't move. And then watch the food drain about 30 minutes. And as the food's almost drained, I would take 30 to 60 milliliters of water and flush it through to make sure all of the food made it to the patient's stomach. And when that happened, I would reclamp it, take this down, and then remove this tube, making sure it's still pinned to the patient. And then I would be done with my feeding. I would pull my bed reel back up, throw away all of my supplies, lower the bed back down, ask the patient if they were comfortable. Do you need anything before I leave?
I don't.
All right, perfect.
Okay.